my name is Jennifer Woodall, and I'm a student at FSCJ in the ADM program, and today I'm going to demonstrate a basic IV insertion. First, I would check the MAR for the doctor's orders, and I'd gather all my supplies. Come into the patient's room, do hand hygiene, identify the patient using two forms of ID, date of birth and birthday, checking it against their armband, ask the patient if they have any allergies. I would explain the procedure to the patient to make sure they're familiar with it. I would choose my gauge of needle. It's going to be a 20 gauge based on what the doctor has ordered and what he needs. Now I'm going to prime my tubing. So I do hand hygiene, put on gloves. Okay, I already have a pre-filled syringe. I'm going to peel open the tubing. Connect the tubing. Prime. And then close in the tubing. Next, I'm going to choose my vein, and I'm going to choose it based on what is most distal. I will ask the patient if they've had any mastectomies or fistulas. I will ask if they are left or right-handed, and choose the arm that does not interfere with their activities of daily living. I will look for a bouncy and large vein. Okay. I will now apply my tourniquet 4 to 6 inches above the site. Check for a radial pulse. Okay, now I'm going to clean the site using an alcohol wipe, and I will wipe in concentric circles. I will let it dry, and then I will stabilize the vein, making sure not to touch the area that I have cleaned. I will pull it taut. Okay, I will tell the patient that they're going to feel a sharp stick. I'm going to insert at a 15-degree angle with the bevel up. Okay, I'm going to look for blood flashback. When I see it, I'm going to advance and lower the catheter, pulling the needle out, pop the tourniquet. I'm going to apply positive pressure. I'm going to attach my neck. Okay, I'm going to aspirate. I'm going at a push stop. I'm going to inject the 3 milliliters. And on my last, apply positive pressure. Okay. I'm going to remove this. I will place my needle in the sharps container. And I'm going to apply the tetraderm, placing it over the catheter, making sure not to cover it where it interferes with the IV. I'm going to peel off the label. Okay. I'm going to document time, date, gauge, location, and my initials. Apply that where it doesn't interfere with the IV. Okay, then I'm going to tape my tubing. Okay. And then when the procedure's over, I'm going to document time and date, that we put it in the right forearm, the size of the catheter and the needle. I got it on the first attempt, how the patient tolerated it, and any instructions.